Hi parents, Dr. Nyat Pham here. Wanted to talk to you about a specific virus that we know can cause asthma-like attacks in both children who have asthma and do not have asthma. So back in 2022, when the tripledemic occurred following COVID pandemic of 2019, rhinovirus, which is typically known as the common cold virus, changed how it affected our children. It actually started causing severe bronchospasm, or otherwise known as reactive airway disease, or asthma-like attacks in children who have never experienced a single wheezing or asthma attack in their life, and or severely worsen the children who have asthma. And that has continued on because this virus wants to stay alive and wants to fight to be able to be stronger than the other viruses. So I would recommend for all of you that if your child is ill with some viral illness, you may want to come to our urgent care and get spot fire testing, where we can test specifically for rhinovirus. And that can help change management, because if you have rhinovirus, and even though you're not wheezing, but you're coughing really bad, and maybe we don't hear wheezing on exam, you may want us to give you a breathing treatment just to see if breathing gets better, cough gets better. Because again, if I know that it's rhinovirus, I know that there's a high probability you'll have an asthma-like attack, for which I can change the management, give you breathing treatment, give you steroids, and then help treat you appropriately. And just remember, asthma doesn't always wheeze. Sometimes asthma only coughs, or asthma just has decreased breath sounds. The chest x-ray sometimes helps us out too, because we can see the lungs very, very hyper expanded in a patient who has asthma-like attack. So asthma is not only a wheeze, but it's sometimes a cough. All right, parents, wanted to share that helpful knowledge to you because we're seeing a lot in the hospital, and I think it's under recognition of the fact that rhinovirus in particular, of all the viruses that are out there, can specifically cause a asthma-like attack, and I have a treatment plan for you. That's breathing treatments and steroids, which otherwise before we wouldn't give you anything. All right, have a good day. Bye.